As you've heard on ABC Radio News this morning, Queenslanders will be able to ask their doctors to prescribe medical cannabis under laws passed in State Parliament last night. Both sides of the House supported it. The laws give certain specialists such as oncologists and paediatric neurologists and palliative care specialists the legal right to prescribe medicinal cannabis from March next year. And it allows all doctors, including GPs, to apply to Queensland Health to prescribe the drug for patients with certain conditions. Queensland's Health Minister is Cameron Dick. I spoke to him this morning and asked him about the laws.
Well, it's a game changer, Steve, because historically cannabis for about 80 years in Queensland has been illegal to possess and use it in any form. And what we've now done is set up a medically supervised system where individuals can access medicinal cannabis products through a doctor in the first instance to be used for any condition that the doctor prescribes it for, and they can use medicinal cannabis in any form that the doctor may prescribe. So it's a big change, and I think it's important because it recognises that there are therapeutic benefits of medicinal cannabis. That's now recognised by law, and people now have a safe framework within which to use medicinal cannabis products, so they don't need to ultimately source illicit product and support that criminal activity in the community.
Now, over the last couple of days, I've spoken with one parent whose very sick daughter finds that cannabis oil stops her continual seizures, and she's really in a very life-threatening circumstance. And another person who has had pain all his life. One is using oil, one is smoking marijuana.
Yep.
What will these laws mean for them?
Well, ultimately, they will be able to go to a specialist. So there are two pathways, if I could just briefly explain that. There are two pathways. So we will be authorising a specialist group. So they will be a specialist who will have an as-of-right power to prescribe medicinal cannabis products. And we think that will be people working in palliative care medicine, in oncology, in cancer treatment, and also those working with paediatric epilepsy. So they will get a right. The other pathway for people to go through is to go to your GP. So any other doctor will be empowered to prescribe it. That will be a slightly more complex process because the doctor may do it as a one-off. So you'll have to make an application to the Director General of the Department of Health as the Chief Executive, who will then authorise the use. But the law says that decision has to be made within 90 days. So this now opens the pathway for those individuals, when the law comes into operation, to get that medically authorised use.
Now, there are people, in particular Mr. Steve Peake, who I'll speak with shortly, whose daughter is very ill, and cannabis oil is the only thing that stops her neurological seizures.
Yes.
This doesn't seem like there's any hope in this bill, even though it was passed last night, for this family at this stage.
No, I think one of the things the Peake family can do, and look, one of the things that has driven this, Steve, is a medical condition of young people and children in particular, particularly those with drug-resistant epilepsy, some children, and many members of the Parliament. And I was really delighted last night that it was supported across the Parliament by all parties, by all members, including independent members. One of the things that has driven everyone is the impact that multiple seizures have on children and how this product can be used to assist. So in relation to Mr. Peake, of course, we are open to him participating in the clinical trial for products that we are doing through Lady Slento Children's Health and the Queensland Children's Research Institute that we have over at South Brisbane. He's very welcome to be part of that, which will allow him to access the drug effectively for free if he wishes to do so. And then as we move forward, he'll be able to have that prescribed. But can I just perhaps address one issue where people think it's only a set type of drug? There's
Sure.
been this misconception that, for example, it's only synthetic cannabis products. I just want to be clear that it's any derivative of the cannabis plant that is a medicinal product that can be prescribed. That includes whole plant, that may be a dried plant material, that may be something administered by vapor, it may be an oil. Those things, it needs to be a medicinal product. Why? Because the product needs to be safe and effective, which is very important for any drug, but we're not limiting it. It's a matter for the doctor to prescribe the product.
I'm talking with Queensland's Health Minister Cameron Dick. This is 612 ABC Brisbane. Apparently the ingredient, the medicinal ingredient is actually I think THC or CBD. Yes. Forgive me for my ignorance.
Yes.
Does the legislation say specifically articulate those elements have to be there?
No, it doesn't specify that those elements have to be there. It has to be a cannabis product. It has to be a derivative from the cannabis plant. But we're not prescribing the quantity or the percentage or the profile that involves CBD or THC, but it needs to be a cannabis product because that's the whole focus of the legislation. But there's no restriction or upper limit, for example, on those sorts of things. That's left to doctors to prescribe. But again, the product has to be effective and safe, like any drug, before it can be used.
How long before legal medicinal cannabis will be available for purchase upon prescription by a qualified or suitable doctor?
At this stage, Steve, we expect this whole new framework to apply from the 1st of March next year. What has to happen now are two things. We need to develop regulations that now fall under the legislation. So it's very clear to doctors, prescribers, including pharmacists. There will be a set number of pharmacists, or pharmacists, not a set number, but pharmacists will need to be authorised to prescribe. So we need to get the whole framework in up and running. We're going to have an expert panel that can inform the Director General in relation to which class of specialists and also in relation to individual applications. We've done a lot of work in that space already, but with the Christmas break coming up, we want to make sure we get it right. We're also going to do an education campaign, both for the community generally about how you go through this process, and also for medical practitioners. So we have to bring the medical system with us, and there's been a lot of support for that, but that's why it's going to take a little bit of time, but then we'll be ready to go, and these will be, I think, the best laws and the most advanced laws in the Commonwealth when they come into play.
I'm talking with Queensland's Health Minister Cameron Dick. We know that there are people who like using marijuana for non-medical reasons. So if they're sitting in King George Square toking on a joint, the police will walk up and say, "I'm sorry, but I'm arresting you." And they say, "I need it for medical purposes." Is that a defence?
I've got to say, Steve, no, that won't be a defence. Unless they have a authorised prescription issued under the law, still the possession of marijuana will remain, cannabis will remain illegal. It is not a way to open up recreational use. It's not the decision of the Parliament. There's strong community support for medical use of cannabis, and that's been reflected, I think, in the Parliament, but the general provisions of the law otherwise apply, and it's still illegal to possess a drug which ultimately can be dangerous, and we now know long-term use can lead, in some instances, to very serious mental health illnesses. So at this stage, it will be illegal, and that's the decision we made at this stage, other than for medical purposes.
Minister, thank you.
Thanks for your time, Steve.
Health Minister Cameron Dick. Steve Peake, father of the young girl that has an undiagnosed neurological disorder, is in studio with me. Steve Peake, what will these laws mean for your family?
First off, I want to say I'm really happy to hear the talk of cannabis in any form and whole of plant. That's what's needed. Our problem is we need something now. Now, the Health Minister spoke about to be part of the cannabis trial so we can access medicinal cannabis now. To be part of the clinical trials, because our daughter's already using a product, she has to go through a 1-month washout period, which means she'll have no seizure control for 1 month. That makes it impossible.
What are the implications of that she'll be in a state of permanent seizure?
Yes, we won't be able to stop. We'll have nothing to stop her seizures other than the medications which have constantly caused it to...
Which threaten her life. The current procedures threaten her life, as I understand.
Exactly.
Okay.
So that's a bit out of the question for us. Also, it's CBD only. The product we're using at the moment is moderate levels of CBD and low levels of THC, and it's the THC component. CBD alone has been proven not to work. It needs the CBD and the THC.
These are the two essential ingredients of medical marijuana that
exactly
that have the apparent benefit.
Exactly. So the clinical trials for us are out of the question, and there's no date for the clinical trials yet anyway. They're talking about somewhere near the end of the year, but there's still no date. Now, I'm pleading with the government to give us approval on a case-by-case basis for our daughter. It looks like in March and I'll have to ask them. It looks like after March we may be able to use what we're using. I really don't know until I check it further. But what we're using, we really need it now, and we need a case-by-case approval now.
Why is it so urgent, Steve Peake, for your daughter Sully? Why is it that you need it right now?
We have nothing else. There's absolutely nothing else to use other than what we're using for her to stay safe and for her to have a quality of life. Like, let's face it, she's terminal, but we'd like to keep her here for a year, 2. And for the last year, for the first time in 7 years, with using the medicinal cannabis, she was progressing instead of regressing. And then she caught this virus, and the effects of all the medications she had, she regressed.
So her prognosis was improving with medical cannabis, not just stabilised.
It improved. She was reaching her goals at school. She even did swimming for the first time in 7 years. She even went swimming in a hydrotherapy pool. Now, with the hospital, we've done what's called the clinical pathways to medicinal cannabis. Now, it's a reporting process, and it goes through all these questions, and it comes down to what's called a risk assessment that's done by the hospital. The risk assessment that's been done is that what we're using is doing her no harm. That's what the hospital's assessed it at. Now, if it's doing her no harm, she's been on it for nearly 18 months. The talk of long-term side effects isn't really relevant for my daughter. It's quality of life, and other kids too. I'm not just talking about my daughter, there's others. Mm-hmm. So I cannot understand why we can't get now, especially the way the legislation is going to change, why we can't get some form of approval. If we can prove she's been using it for a period of time, it's doing her no harm, and it's only been a benefit, and she's terminal, why we can't get some form of approval to continue using what we're using.
What's your daughter's prognosis today, Steve Peake?
She's not well. We look like we're going to have to take her to the hospital today. So I don't know what's going to happen.
It won't be until March next year that we'll be able to access this product. The aim is apparently to try and source it locally. Are there any products that can be obtained quickly from overseas that you're aware of?
Not that I know of. Cost is prohibitive. Time. Look, where we get it from currently, we get it from a woman in South Australia. She does it out of the kindness of her heart. She charges us nothing. The product has proven to be safe. Nobody's had any adverse side effects from it. Sully certainly hasn't. And who are we hurting? We're not hurting anybody.
Well, the law's been changed. What are your thoughts about other parents who have children with conditions that require this? So can you speak to that at all, Steve? I know it doesn't solve Sully's problem today, though.
I think it's fantastic that they're going to go down. And look, we've heard media headlines about cannabis is legalised. There's been all these headlines. There's been all this talk for more than a year now. Nothing has changed up to date. So I'm hoping that this is how it's going to be. People will be able to source a local product, a whole of plant product with a prescription and be able to use it, but we need it now.
Are you telling me that this legislation won't save Sully's life? Is that what you're telling me?
The way it's going, though. I don't think so. Her next seizure could be her last seizure. There's no way of telling.
And you don't want to take that risk?
No, we don't. We want to give her a quality of life and keep her here for as long as we can.
I appreciate you making the journey once again into the ABC to tell us the story. Thanks so much.
Thank you for the chance.
Steve Peake, whose daughter Sully has an undiagnosed neurological disorder, which appears to only be managed with any sort of quality as a result of the use of cannabis oil. It's 12 minutes to 9.